breathing, which is normally done through your nose. Of course, we all know that. So our today's topic is mouth breathing. That is, breathing which is done through your mouth instead of your nose. And when is this? In the relaxed and the restful situations. If you are doing some workout or at gym, running, breathing through mouth is okay. That is situational breathing. But if even in your restful, relaxed state, you're doing some normal course, in that situation, if you are doing your breathing through your mouth, then my friends, it is a matter of concern. If someone around you or your children are facing this issue, then you are watching the right video. Yes, welcome to my show Monday Mornings with Mansi. And here you are on my channel, Dr. Mansi Shah. If you are new to this channel, please press the subscribe button and do not forget to press the bell icon. So whenever I come on Mondays, you will be notified. What do I post is the oral health related videos. And if you have any issues and concern, you can mention them in the comment section below. Coming to our today's topic, mouth breathing. What exactly is mouth breathing? I have already told you. That is breathing through your mouth. Now first let us know or understand if you are really a mouth breather. So there are some ways and techniques which I could help you out with. So the first thing is stand in front of a mirror or take a mirror in your hand. Watch your nose. If you are a mouth breather, then you would have a full grown nose in the size. The shape has to be normal. You cannot exactly distinguish normal from abnormal, but yes, by observing people's, you will understand that. And watch me while taking the breath in. Okay, on purpose I'm doing it so that you can see that in the video. When I breathe in, the nares, they squeeze. And when I exhale, they flare up. So this flaring of nares, they indicate that you are breathing normally through your nose. If that does not happen, it is indicating that you are a mouth breather. The second thing is, you have to take a double-faced surface mirror. Now this is the mouth mirror which I have used in my clinic. So it is a single surface mirror, but you in market get two surfaced mirrors. So the upper surface is I am keeping near my mouth and so the surface which gets fogged or has that warm thing is indicating the side or the surface through which you breathe. That is, if you are a mouth breather, the double surface mirror will be fogged from the lower side, and if you are a nose breather, then from the upper side. The third test is using a wisp of cotton. That is, you use a small wisp of cotton, try and hold it here near the mouth breather person. If the wisp of cotton is blown by the mouth, you understand that he is a mouth breather. The fourth test is the water holding test, and I think this is the most easiest and the most significant test to prove it. So a glass of water, hold it in your mouth. See how long can you hold it. Okay, so if you can hold it longer, mouth breathers usually cannot hold it longer. If you can hold it longer, then you are a normal nasal breather. So, if you have done with the diagnosis of the mouth breathing, let us come to know what kind of mouth breather are you. That is, what is the reason behind your mouth breathing? So I will divide it into three categories, my friends. The first is the anatomic one. That is, the nose is small. Some part inside the nose is short, deviated, and that's the reason you have some restriction of the air to pass inside your mouth. So you have adopted for this mouth breathing habit. The second one is obstructive. That is, enlarged adenoids. So what are adenoids? Let me tell you. Adenoids are a tissue which is similar like tonsils, which is present right behind your nose, and it does the work of filtration of the air. It catches the bacteria from the air which is passed down through the nose. If the adenoids are enlarged, so it blocks the nose. So the airway is blocked, and that's the reason you shift to breathing through your mouth. Now, the second obstruction can be a deviated nasal septum. That is, this is what is called as a nasal septum. If it is deviated, that is crooked nose, what we call it as. So if there is a deviated nasal septum, then there can be an obstruction in the passage of air. The third thing is some infection, upper respiratory tract infections. In that case, if you need more air in, then you can switch to mouth breathing. And the third is the habit. That is, for no reason you have opted for this mouth breathing habit. Any of the reasons, you have to diagnose by yourself or visit your dentist, and they'll help you out to diagnose what kind of a mouth breather you are. Depending on this types, we will decide what treatment it has to be. Like if it is obstructive because of some reason, then the reason has to be treated. And if it is because of the habit, then the habit has to be treated. Okay, so now for the clinical features of mouth breathing, let us see how you can imagine me. So if I am a mouth breather, watch me, how I'll breathe and what can be the changes that you will observe. So, okay, there is definitely some exaggeration done, but it is only for the video purpose. So as you can see, the face from the side as I breathe in has become elongated, of course. So in mouth breathers, the most common thing that you could see from the external thing is elongation of the face. Also, if you have observed carefully, the mouth remains open, the tongue depresses down. So in the picture besides, you can see how the tongue is being depressed. Normally, the position of your tongue in restful and relaxed position, it has to be behind the upper front teeth, hitting the palate. So, if your normal state is like this, then in mouth breathers, the position of the tongue is depressed. Because of this, the cheeks exert some pressure and the shape of the palate changes from a U shape to a V shape. So there is narrowing, there is change in the facial structure in the upper portion. Now the lower portion, the mandible drops down. As it drops down, it goes back in the development and it gives a different structure or different shape to your overall facial thing. Now, what are the internal changes that I would say? Mandible is going down, the maxillary, that is the upper arch, is becoming narrow. There is opening of the mouth. So, as you can see it in the picture, there is proclination of the teeth. That is, the teeth are coming forward. The tongue is placed between the teeth. There is changes in the speech. The gums, that is the pink portion above the teeth that is present, it becomes dry, red and swollen many a times. So these are the changes, the facial changes and the internal changes which you can observe very easily in the mouth breather. Now also in the mouth breather, it is said according to the researchers that they have a little lower IQ. So if it is because of the habit or because of some obstructions, we should definitely get it corrected. There are various changes seen in the spine. The mouth breathers usually have a bend in the neck. There are cervical issues that occur. So, treatment, yes, it is in your hands and definitely a dentist can help you. Do keep watching my show Monday Mornings with Mansi and stay tuned with me. Next Monday, I will be coming up with the treatment of the mouth breathing habit. So, stay tuned and keep watching. Do like, comment, share and subscribe this video. Share it with your friends and your family members. Help them to get rid of the unwanted habits in their children. Stay healthy, stay happy and be fit. Thank you.